Hi, this is Junaid, neurocritical care stroke and epilepsy specialist. In the last few lectures, we talked about virtual care as the gateway. Then we talked about digitally enabled care. And now we're going to talk about the pinnacle of virtual care strategy. What is it? It is basically virtual hospital at home. The true vision of this whole situation is basically bringing the care to the patient rather than bringing the patient to the care. And one of the key things that we're going to see is that we are going to move towards hospitals that can be in patients' home. And how will we be able to do that? Well, we can do that. Clearly, because digitally enabled services. We can have radiology service come to home. I mean, chest x-rays are already very portable. They can plug into a regular AC plug where you make your coffee. As a matter of fact, there's a portable MRI machine in which you can actually plug it into the same plug and then get MRIs of the brain anywhere, portably basically. And you can wheel it from one place to another, specifically in the hospital and eventually on vans around the world. So we are actually seeing a lot of these services that we used to think that are not able to be delivered at home. We are able to see that. As a matter of fact, India and Pakistan, where I'm originally from Pakistan, you already see a lot of lab work is basically done from home. There are services that are available right now where a phlebotomist goes to your home, takes your blood and goes back, or a stool sample or whatever, nasal swab, whatever. So these are things that we are actually already seeing. And of course, you get more personalized care. You get better patient satisfaction. You get better family care satisfaction when you're providing care at their location. And they are actually improving better because they are actually within their native environment and they feel much more comfortable getting care in that environment as well. So definitely patient engagement, patient satisfaction is much higher. And all these services that we talked about are, physician can be virtually available. There could be, a provider that can go home visits. It could be a physician or a nurse practitioner or a physician assistant. Physical therapy, occupational therapy can do their rounds, either in person and then give them exercises and then provide them support virtually. So there are so many, again, different models of virtual care strategies that are coming on that we're going to see significant movement towards this. And this is not just that we cannot provide a hospital experience. I mean, as a matter of fact, just talk about virtual clinical trials. We say that the academic institution will never be replaced. We are now moving actively as fast as possible towards virtual clinical trials because it is so much easier to deliver and you are able to get better diversity in your virtual clinical trial because we have a significant problem in adding females, in adding different races within our virtual clinical trials. And once it is digitized, once it's digitally enabled, we will be able to provide better clinical trials, as a matter of fact, as we were able to do at a fraction of the cost that we are providing right now. Because all of these communication and coordination issues are basically a chat application away. Visits are virtual visit away. And then of course, if you need something specific, you can actually deliver medicine and get labs, etc., virtually as well. And making sure that the compliance rate goes through the roof because the dropout rate goes very low because clearly you are going to be able to get all the care you need at your home as well. So virtual clinical trials is going to become a big thing as well, while we're also covering towards virtual care as a hospital. As a matter of fact, if you want to have a whole talk about virtual clinical trials, put that in comment. I'll make sure I make a video on it as well. And this is shown in clinical results that hospital at home can deliver approximately the same care, if in some cases even better care at home as compared to traditional hospitals, which are brick and mortar. This is a study from Mount Sinai that tested the model from 2014 to 2017. Hospital at home patients had a lower 8.6% readmission rate as compared to the hospitalized patients. Why? Well, that's something that you should know because we have to, as we said, we are continuing towards more and more moving away from inpatient services, which is a bulk of expenses of our chronic care patients. And as soon as we are able to bring in virtual hospitals at home, this will be significant impact on our system as a whole in cost savings. Another study did the same thing And we are looking at more and more areas in which we can see that. As a matter of fact, again, COVID was one of the things that provided that breakthrough that we needed. CMS opened the whole reimbursement possibility for hospital at home, specifically because there were capacity issues during COVID. And then when those capacity issues were reached, they were able to create a simpler, more model where hospital at home can be done. And the CMS calls it hospital without walls. And the idea of this is that it can be not just your home, but it could be, another facility, etc., where you can actually provide the same level of care virtually, as we know we can, right? Specifically, there's data now to prove it, as I discussed on the Mount Sinai study. And we're going to see continuous movement towards the pinnacle, the true pinnacle of virtual health strategy, which is virtual hospital at home. And of course, this is clearly, you can say, well, great, or well, these are small areas. Not really. You see, there are people, there are big, large corporations that are actively investing in that areas. Take, Amazon Care, Intermountain Ascension combined launched Hospital at Home Healthcare Alliance, which is basically creating models, creating areas where they can actually deliver hospital at home. UPMC and Advocate Aurora got into recently an agreement to do the same thing. And similarly, we are seeing that as an international effort as well. UAE set up first virtual hospital in the Middle East as well. So we are seeing constant movement of both funding, resources going into that. And again, this is big news and good news for all of you, especially for old folks like me, that we're never able to provide this kind of care at home, and you may be able to provide that. So choose your medical specialty correctly. And I just wanted to give you a broad idea how the trends are moving forward in the healthcare delivery models. Again, thank you so much for your time. We'll see you in the next lecture.